Good morning, good afternoon, good evening, everyone. As people join, I'll just give a few housekeeping announcements. Please feel free to introduce yourself in the chat box. This meeting is in French, English, and in Spanish. So in order to access any of the other languages, please click on interpretation and then select your language. Make sure that you remain on mute while others are speaking. And please feel free to raise your hand using the Zoom function at the bottom right-hand corner of your screen during the Q&A portion. The recording and the presentation slides will be shared via email after the webinar and also will be posted on each of the partners' websites. All right. And with that, I will hand over to Shikupe.
Good morning. Thank you so much. Good morning, good afternoon, good evening, everyone. It's my real pleasure to welcome everyone here today to yet another milestone for the nurturing care movement that we've all been working on building collectively for the past 5 years and beyond. I mean, this webinar is a testament to that, bringing together, a range of networks within early childhood and health under one umbrella. So today is an important milestone because we're moving from the framework to building tools for implementation. And on today's webinar, it's going to be a really exciting launch for the Nurturing Care Handbook, as well as the Nurturing Care Practice Guide. And we'll get to hear from countries on how these resources can be used to address existing gaps. So without further ado, it's my pleasure to introduce you to the Global Lead for Early Childhood Development at UNICEF, Irina Dia, to share some opening remarks. Over to you, Irina.
Thank you, Shekufe. Hi, everybody. Greetings from the Innovation Hub in Helsinki. It's a pleasure for me to be here with you today, even if it's going to be a short pleasure because I will have to run back to the meeting I'm here to attend as soon as I kicked off this discussion. But it was really important for me to be here and celebrate this milestone with you all. I would like to start by saying that, I'm sure we all agree that the foundation for lifelong health, productivity, well-being is built in the very early years, starting from pregnancy. And these findings from the neuroscience and evidence shared in the 2016 Lancet series have informed what we typically refer to as the nurturing care framework. In layman's terms, what it is that a child needs to reach its full potential, these 5 interrelated and divisible things: good health, adequate nutrition, safety and security, responsive caregiving, and opportunities for learning. So following the launch of the Nurturing Care Framework in 2018, there has been numerous of resources that have been developed to guide its implementation and respond to the demand for supporting advocacy and socializing the concept. We have been on this journey for the past 5 years, as Shekufe already mentioned, and today we can celebrate the global launch of 2 important and long-awaited resources: the Nurturing Care Practice Guide and the Nurturing Care Handbook. Now, the Practice Guide and the Handbook build on already existing resources, and they will help us take nurturing care to another level. It has been developed, both have been developed to help any government, donor, development partner, institution, practitioner, individual who wants to take action to help children survive and thrive. The handbook specifically shows how governments and other stakeholders around the world can put nurturing care in practice. It guides implementation by bringing together all the elements of enabling environments and service provision. And like the framework itself, it is organized around 5 strategic actions with a separate guide for each of them: lead and invest, families and communities, service strengthening, progress monitoring, and scale up and innovation. As for the practice guides, it responds to requests from practitioners and country teams who want to understand how to adapt health and nutrition services to be supportive of nurturing care. To be supportive of nurturing care. To be supportive on nurturing care and also to strengthen caregivers' capacity. It is intended to be used as a complement to existing guiding packages and instruments, and it describes what managers can do to prepare services and better equip providers including practical suggestions for what they can do as part of their ongoing contacts with families. It is very important to emphasize the fact that while both sets of tools have been developed as global resources, they are not prescriptive or universal, and they will have to be adapted for different uses in respective contexts. So they are meant basically to provide guidance on the framework's implementation and will support the holistic development of the child by promoting nurturing care in strong collaboration with all sectors and actors to deliver early childhood development as an outcome for all children. I encourage you to be engaged today and beyond. And if you have any questions, concerns, please feel free to reach out to any member of the Global Nurturing Care Core team, which I really like to thank here today for making this event possible and for really reaching this milestone. With that, I will hand over to my colleague in UNICEF's health section, Anne, for an overview of the Nurturing Care Practice Guide. And I thank you again for your attention. Over to you, Anne.
Thank you. Thank you, Irina, and hello, welcome everyone. I'm very excited to introduce you and provide a broad overview. You can go to the next slide, Peter, please, of the content of the new Nurturing Care Practice Guide. This guide was really developed in response to requests that we received from many of you, from our teams and countries, from government partners, from implementing partners, to have more practical guidance and some examples, some specific and practical examples on what exactly we mean when we keep saying we need to strengthen services to be able to better support nurturing care. So this is our response to that, and we hope that it will be useful to many of you. Next slide, please. All right. So the services that this guide specifically focuses on are routine health and nutrition services. And the reason for that is that these services really provide already existing opportunities through regular, often scheduled, but also unscheduled touch points where caregivers and children engage with providers throughout pregnancy and early childhood. There are opportunities through creating an inclusive and more family-centered environment in health facilities and by capacitating providers to even better support caregivers in understanding the importance of and acquiring skills to support their children's health and healthy development. It is really parents and caregivers that are primarily responsible for the care of their children, but all of them require some kind of support and encouragement to do so. Then there are others who might have limited capacity or feel insecure. An example for that, for example, are adolescent parents, single parents, and they might need some more intense support and services. And we touch on those in this guide. Next slide. So as Irina said earlier, the Nurturing Care Framework really has 5 components. And the existing services are 2 of the components that we're targeting in the guide. So it's good health and good nutrition, but access, quality, and utilization of these existing services is often not optimal. So one important thing is to make sure that really all children have access to good quality routine health and nutrition services. So that is the component of strengthening services. But then there's an opportunity to add to these services. So to strengthen the support for the other 3 essential components of nurturing care, those being responsive caregiving, early learning, safety and security, but also to strengthen support to caregivers whose mental and physical well-being are really essential for them to be even able to provide nurturing care to their children. So the practice guide focuses specifically on ways to add support for these 4 elements to existing services: responsive caregiving, early learning, safety and security, and support to caregiver well-being. Next slide. We don't start from zero in the guide. We really build on skills and intervention that are already introduced in existing foundational training packages for service providers, which were designed for health workers, addressing early learning, responsive caregiving at varying levels of intensity. You see some here displayed on this slide. These foundational tools and packages are really intended to be used as part of routine health services at facility or the home level for children 3 years and younger. but they have been adapted in many contexts for use in other platforms, such as home visiting by social workers, parenting programs for groups, trainings for early childhood educators. So the Nurturing Care Practice Guide itself is not a training package, but it takes many of the skills and interventions from these existing training packages and shows how or where they might fit within existing services along the life course. Next slide, please. All right, so the Nurturing Care Practice Guide targets, the target audience are providers and managers of health and nutrition services. As I said already, it focuses on 3 of the 5 interrelated components of nurturing care, as well as on caregiver well-being. It focuses on the universal support and services that really all children should be able to access, but it also emphasizes the need for more targeted or indicated support for some children and families. It introduces considerations to serve all children and their caregivers, including those children that have chronic illnesses, developmental delays, or disabilities. It is also equally relevant and touches on adaptations that might be required in humanitarian and emergency settings. The guide, and I hope you will have a chance to take a deeper look after this webinar, many of you might have already, has 3 sections. One is an introductory part on nurturing care, so it gives the rationale for strengthening support for these elements that we're introducing. And a little bit of that I shared in my introduction. And then the second part really targets managers of services, managers of facilities on what they need to do to prepare and enable those health and nutrition services, to reduce barriers, to build skills of providers, to identify resources for additional support. And I'll go a little bit more in detail on that. And the third part really talks about practical examples of what providers can do in existing services. Next slide. All right, so the second part, as I said, it really targets the providers of services and some examples of what these managers can do. So it talks about what can we do to make facilities more accessible and welcoming for all children. What are some criteria to make facilities actually inclusive for families and children, including those that might have special needs. It talks about what do we need to do to enable the services to support caregiving. So how can we integrate these additional elements of nurturing care in case management protocols? And that might, for example, mean that we need to increase the time intervals that a provider has to engage with a caregiver and children, to add some additional interventions and engagement. It talks about how do we need to make sure that these additional elements that we integrate in services need to be considered as part of supervision, as part of mentoring and additional support to providers. It talks about what are the kind of capacities of service providers that they need in order to be skilled enough to support caregivers. And you see this table on the right-hand side. It talks about, on the one hand side, the basic interpersonal communication skills that providers require, which will help them in general to do what they are supposed to do. But it also talks about the specific skills that they really need to support caregiver in improving their practices for nurturing care. It talks about what do we need to do, what do we need to consider in the context of a humanitarian or health crisis, to not forget or neglect core elements of nurturing care. And then it identified some of the needs that providers, that managers can actually help to advocate for and make sure are accessible for those families and children that need some more specialized support. Next slide. So the third part, as I said, is going very specifically targeting the providers of different services. It talks about what it is that providers can do. They can observe interactions between caregivers and their children. They can ask questions and discuss questions and concerns that people have, but they can also introduce certain practices and be a model. And by that, they can support caregivers to be more responsive, to recognize opportunities that they might have to help their children to learn. They can help them to understand what it means to provide a safe and protective environment, but also to take care of themselves. And you see there are some sort of core practices that providers can help caregivers to acquire. Next slide, please. And then what the third part does, and here's just one example, it really pulls out specific touch points where providers engage with caregivers and children. So in antenatal care, in the context of well child services, and the example that you see here is in the context of sick child services. And what we do is to look at these caregiver practices that I mentioned earlier, and what does that specific mean in the context of caring here in this example for a sick child. So a sick child, the most important thing is certainly not that the child sort of plays and learns, but the sick child needs to be nurtured. So what does it mean to feed a sick child, to make sure that the sick child is not left alone, that pain is managed, and that caregivers have actually the support and environment to provide care for a sick child while they might need help with their other duties or other things. So these are some very practical and concrete examples in the third part of the guide for these different existing touch points. Next slide. So what's next, and what are some ways on how we hope this guide might be useful to you in the context where you are working? So we think there might be opportunities to actually use the guide and convene at country level to review what are we already doing, or where are there opportunities to complement? What are some new ideas that the guide introduces that you might not have thought about before? And what we certainly don't expect is that everything that's suggested in this guide should be done at once. But there can be a phased approach. You can look at what are some low-hanging fruit of things that we can really change at larger scale. What are some services where there are opportunities? How can we document what we do? How can we learn? And how can we scale? You can discuss across providers, and we really hope that it's an opportunity to come together as health providers, as nutrition service providers, to institutionalize skills building. So are any of the foundational packages that I already mentioned already used in your context? Are there opportunities to integrate some of these elements in but also in in-service training, and incorporate them in mentoring and supervision efforts? You can use sections of the guide and disseminate them individually. So particularly the third part, you can pull out these different sections and share the sick child section with providers of IMCI services, and the ANC section with providers of antenatal care services, etc. And then, of course, we are very interested for you to share with us what you do, if the guide is useful, what kind of adaptations or changes we might do, and to actually learn from you what you're doing, how you're applying it, how you strengthen these elements in the context of health and nutrition services, so that we can help other countries to learn from what some of you might be doing. Next slide. So with this, I want to thank all of you, particularly the many, many people across the world, really, truly, that helped to inform and shape this guide through its many iterations. And I want to give a very special shout out to Jane Lucas. Jane, if you're here, turn on your camera. She's really been the mother of this guide, with all her knowledge and experience that has gone into this. So a special thanks to Jane on behalf of all of us. And with that, I pass it on to Sheila to introduce the other new resource, the updated Nurturing Care Handbook.
Thanks, Annie. You can go to the next slide. Perfect. So my name is Sheila Manji. I'll be presenting the handbook today, and I'll put the link in the chat for you so that you can follow along should you wish. We have 6 guides in the Nurturing Care Handbook. The first guide is the Start Here guide, and that is where we recommend that you start. And then the 5 remaining guides each map onto one of the strategic actions in the Nurturing Care framework. So the handbook is a set of 6 guides. Next slide, please. The guide is intended for a variety of users. It could be policymakers, it could be people from working in training institutions, it could be practitioners. It is very diverse. In the Start Here guide, you will find a table that maps out prospective audiences for each guide, but we do encourage you to look at it from many different perspectives and see how to use it across different audiences. because we are all at different starting points in each of our contexts, it is difficult to say which order you might look at the guides. We definitely recommend starting with the first one, start here. And then after that, you may find that you move around the different guides, maybe starting with strength and services, moving back to lead and invest, looking at two in parallel. They can be used in any combination and in any order that makes sense for you. Next slide. The handbook builds on these two images that we have in the nurturing care framework, and these underpin what we strove to do in the handbook. The first, we know that we want to ensure that all children receive nurturing care. So as we thought about the strategic actions and we thought about what actions could be taken, we were trying to think about what needs to happen under each of those strategic actions for the children to receive nurturing care. And then the second is this aspect of enabling environment. So we want to think about what are the caregiver capabilities, what do we need to do to empower communities, to ensure the services are supportive and that the policies are enabling. And so you will see that we give attention not just to what's happening at the front line, but to that whole wider ecosystem. Next slide. In the Start Here guide, as you might expect, it's giving you an orientation and an overview to what the handbook as a whole is, but it also points you towards some very useful resources or websites that might help you as you think more broadly about the work in your context. Next slide. Now, each of the 5 guides then, so the ones that map onto the strategic actions of the framework, each of them break down into 3 thematic areas. So for example, Lead and Invest has thematic areas of governance, planning, and financing. And so that pattern is repeated in each of the guides. If you go on the next slide. Next slide, thanks. So here is an example of what you would expect to see in each of them. They follow a very similar structure. The first would be to unpack what the strategic action is about and why it is important for us to be addressing this area. Then for each of the thematic areas, you would find suggested actions and a set of common barriers or frequently asked questions. These are things that have come up over and over and over again. And so we've tried to compile them in one area and then also provide recommendations of actions that you could take to advance or mitigate those issues that are coming up. There are across the guides various tools, various checklists, various links to articles, websites that would be of use, and various case studies as well, showing how some of these actions have been taken forward in different contexts. Each of the guides concludes with a section on signs for monitoring progress, which gives you an indication or a way to reflect on how are you doing in a particular area and gives you a sense of something you might want to focus on going forward. Next slide. So if we take, for example, Lead and Invest has 3 thematic areas: governance, planning, and financing. And this, from the governance section, are examples of the frequently asked questions that are addressed, as well as the steps that have been shown to be effective, so the suggested actions. And the idea is that you would identify where you wanted to focus, so which strategic action you wanted to focus on, then within that, which thematic area you wanted to focus on, and then within that, which steps you wanted to focus on. Depending on where you are and what your needs are, you may find that all the steps are relevant, or you may find that only some of them are relevant. And so the idea is to provide you with a menu of options that you can choose and adapt based on your context. It is not prescriptive, and it is not necessarily meant to be used in a sequential manner. So again, it goes back to what is the starting point in your context and where are the areas that you want to focus on. Next slide, please. So this is an example of the signs of progress that you can find at the end of the Strategic Action 1 guide, Lead and Invest. So a few kind of markers to help you identify, am I making progress in this area? So is there a national coordination mechanism? Is it in place? Is it functioning? Are there champions for nurturing care across different sectors? Do we have a national roadmap or strategy? Do we have sector-specific plans that are costed? And is there government spending, and is it equitable? Next slide. And then, as I mentioned, in each of the guides, you will find various boxes, and these boxes highlight different tools or resources that could be useful. So in the Lead and Invest, you will find information about the Nurturing Care Advocacy Toolkit or the Countdown to 2030 country profiles for early childhood development. And then there are various case studies. Some of these are a specific example from a specific country. Some of them might be initiatives, or some of them might be areas of work that could help inspire action. Next, please. So the take-home message is that the handbook is meant to be a resource that can support reflection, that can support planning, action. And because we are all at different starting points, we have to work from where we are at. So we don't necessarily expect you to use the guide starting with Lead and Invest and moving sequentially through. You may find that if you're part of a technical working group or a multi-sectoral group, or even within your own organization, you want to focus on a particular strategic action. And then you would deep dive there and use that as a way to inform or reflect on where you are at and where you want to go next. And because we are so many, as Shikofi alluded to in the beginning, we are a collective of many, many different organizations, many different sectors, many different constituency groups. And so each of us would find a different way and a different home and a different place to land in the handbook. And as long as we are each finding a piece to move forward, we can see some progress in those areas. Next slide, please. So lastly, I'd like to close by acknowledging the contribution of numerous individuals and organizations to the creation of this handbook. The handbook was developed by the World Health Organization but benefited from many, many, many inputs from over 20 organizations and institutions. We also held an online consultation of the draft version of this handbook in 2021, and over 100 individuals contributed and helped us to further refine the handbook and prepare it for its release today. We would like to give special thanks to Mark Tomlinson, Kelly Jamal of the University of Stellenbosch in South Africa, and Bettina Schwethelm, an independent consultant who were members of the core writing team. And we'd also like to acknowledge the Conrad and Hilton Foundation, the Children's Investment Fund Foundation, and the King Baudouin Foundation of the USA for making the development of this handbook possible. Next slide, please. So we encourage you to look at the Nurturing Care website, the ECDAN website for more information, more resources. We will absolutely share all the links for you in the chat, but also as well afterwards in the post-webinar email. And if you do have questions about these resources, please do feel free to put them in the chat. We'll start collecting them now. But I'm going to hand over to Boniface from UNICEF to lead us through the next session. Thank you.
Thank you very much, Sheila, and thanks you all for joining. You have heard from Annie giving us an overview of the handbook, and also Sheila has given us an overview. Now we want to move to have a discussion, and we are honored that we have 4 distinguished colleagues who are going to help us in this session. It's now taking to say we have heard these are the documents, but in practice, how is it going to look like? So allow me to invite Dr. Caroline Mwangi. She is the head of neonatal and child health in the Ministry of Health in Kenya. And also allow me to welcome Dr. Oka Kwame. He is the director of the National Nutrition Program in the Ministry of Health, Public Hygiene, and Universal Health Coverage in Ivory Coast. And I also have the pleasure to introduce Meran Picoro. She's the Maternal, Newborn, and Child Health and Nutrition Program Manager for PATH in Mozambique. And we also have Dr. Rajesh Mahita. He's the consultant at WHO and the former regional advisor at WHO Southeast Asia Regional Office. Thank you all for creating this time that you can be part of this conversation. So allow me to pose the first question to Dr. Caroline Mwangi. Dr. Mwangi, how can the Ministers of Health use the practice guide to strengthen the capacities of the workforce and improve the service delivery? We have heard, but how can now the Minister of Health, respond and use this package in practice? Over to you, Dr. Caroline.
Okay, thank you. Good morning, good afternoon, and good evening, colleagues. Thank you to the team for a great introduction to the practice guide and the handbook. So I was invited to give my perspective on how the ministries of health can strengthen capacities of the workforce and utilize this practice guide. So as you've heard, countries need to review the practice guide and the handbook and adapt to their local standards, to adapt them to be to fit their local practices and guidelines. So I think the first way would be to sort of integrate these suggestions that have been given in the guide, the practices, because the emphasis is on how the healthcare provider can identify and can observe caregivers when they come to the health facility. And there's mention of both the inpatient and the outpatient, and also along the continuum of life, all the way from the antenatal period, postnatal, to the well child, and indeed to the child who's sick, both at outpatient and inpatient level. So the first thing would be to integrate some of these checks into our policies and guidelines and training manuals for our healthcare providers. The next would be to this implementation of these guidelines and facilitating our healthcare providers would require resources and allocation of resources to facilitate this, investing in spaces for children, investing in safe spaces, the play boxes that have been mentioned at all levels of care, starting from the primary healthcare facilities, for instance, in our country, all the way to the inpatient facilities. Are they child-friendly? Are they encouraging the child who's come into the health facility? The three aspects: the responsive caregiving. Is the environment safe for the child in the health facility? So such things would require adequate resource allocation. And one of the ways the ministries of health can support this. Another way is having a skilled health workforce, both in the right density, distributed adequately, in the right quantity, and also with the right skill set. So we do know that, and the handbook, the guide has mentioned that there is a specific training for healthcare workers, the care for child development. So for those who have undergone this training, this guide would act as just a reminder and just to affirm and also sustain the knowledge and the skills that they've learned. But for those who've not been trained, it would be an opportunity to introduce this concept of nurturing care integrating it into our health when we attend to sick children and even indeed to the mothers during pregnancy. Another way would be also investing in training and also integrating this into the pre-service curriculum would also be one of the ways that a ministry can increase the capacity. And even having this guide, snippets of it or part of it introduced at pre-service level and having students go through it across all the cadres. So we're talking about a whole health systems strengthening approach. Another one would be ensuring that the commodities supporting health facilities, indeed the managers, because they're the ones that would address the immediate environment that would enable the healthcare provider to attend to when attending to these children and indeed the pregnant mothers and even the family as a whole, to adequately offer resources that are that indeed will will actually provide an environment that this healthcare worker can assess a child, can assess a caregiver and their interaction with the child, and offer advice and counseling as needed on the components of nurturing care. So another way that we can increase this is for the use of maybe the community health volunteers in our country or community health workforce when we increase their capacity to actually support caregivers at household level. So one way would be increasing the capacity of the community healthcare workers, and that's through training them on care for child development, supporting them to go to homesteads to see how caregivers interact with the child in a home environment, especially a well child, and also counsel the caregiver on ways that they can provide an optimum environment. We've also been told about the offering nurturing care, especially to those children who are in need, the ones with special needs, the ones with disabilities, the ones with HIV and emergency settings. So the Ministry of Health should integrate and take this into consideration when developing our policies and guidelines for dissemination, and when interacting with our healthcare providers and indeed facility care managers, to be able to advocate that the adequate resources and indeed a whole health system strengthening approach is used, so that we can facilitate healthcare providers to give or provide an optimum environment. Thank you.
Thank you very much, Dr. Mang. And to all of us, feel free to continue posting your questions in the chat. And if you also have suggestions on how you're going to implement the two products in your country context, feel free to continue doing that. With that, let me move to Dr. Kwame. Dr. Kwame, how can the Ministries of Health, and specifically those for maternal, newborn and child health and nutrition programs, use the practice guide to strengthen the capacities of workforce and also service delivery? Over to you.
Merci. Alors, je voudrais donc commencer par dire merci et dire que nous sommes heureux de participer à cette réunion pour partager donc les opportunités que nous disposons pour l'utilisation des guides donc pratiques pour les soins attentifs. Il faut alors, nous avons l'occasion aujourd'hui de bâtir sur notre expérience. En effet, depuis 2017, la Côte d'Ivoire participe à la réflexion et à la mise en œuvre des soins attentifs pour le développement de la petite enfance, marquant ainsi donc son engagement qui se traduit dans ses orientations stratégiques qui figurent dans son plan national de développement pour la période 2021-2025. Cette priorité est définie dans l'effet 2 de ce document, à savoir que les populations, notamment les femmes, les enfants et les personnes à besoins particuliers, accèdent à des services de qualité et adoptent des pratiques favorables à la nutrition et au développement de la petite enfance. Cette priorité est déclinée en plan donc opérationnel sur les 5 prochaines années qui vise donc au passage à échelle de l'intégration des soins attentifs dans le paquet de nutrition ouvert dans les centres de santé. Également, la mise en œuvre d'interventions communautaires à travers la stratégie de convergence portant sur les foyers de renforcement des activités de nutrition au niveau communautaire, donc qui délivrent des soins de nutrition communautaire et un paquet de soins attentifs pour le développement de la petite enfance. Nous bâtissons également sur notre expérience à la mise en œuvre de projets communautaires d'intervention de nutrition et de développement de la petite enfance. Aussi, la Côte d'Ivoire participe au programme Global Scope for Early Development pour développer et étudier une nouvelle échelle universelle pour le développement de la petite enfance pour les enfants de 0 à 3 ans, qui se déroule actuellement donc dans une commune d'Abidjan. Toute cette expérience a bénéficié de plusieurs financements, dont un investissement de l'État de Côte d'Ivoire à travers donc, un prêt de la Banque mondiale. Nous bénéficions également de l'appui de l'UNICEF, de Power Nutrition et de la Fondation Jacob. Alors, nous avons des opportunités énormes pour l'utilisation de ces guides. Aujourd'hui, nous passons à échelle sur les interventions de nutrition, aussi bien au niveau des structures de santé et également au niveau des communautés, à travers les soins mère kangourou, à travers l'initiative structure sanitaire Amis des bébés, à travers donc le suivi promotion de la croissance, la vaccination, la nutrition de l'adolescence, la nutrition de la femme enceinte, de la femme allaitante. Toutes ces occasions donc, et portes d'entrée du système de santé seront mises à contribution. Nous avons également l'occasion pour utiliser ces guides-là au niveau de l'organisation des services de santé, pour le renforcement des capacités du personnel de santé afin de répondre aux besoins des enfants. Nous entamons également la réflexion sur la santé mentale et le soutien psychologique des enfants et adolescents en Côte d'Ivoire sous l'initiative de notre programme national de santé mentale. Autant d'opportunités qui nous permettent de nous projeter sur les priorités pour 2023-2024. Il s'agit pour nous donc, à partir de ces guides et qui tombent à point nommé, de procéder à l'intégration des messages sur le développement dans tous les matériels de nutrition. Nous avons également, nous prévoyons également d'intégrer les messages et des activités spécifiques donc, dans tous les matériels clés de développement de la petite enfance. Nous procédons également au renforcement des capacités du personnel de santé sur l'ensemble du territoire, l'ensemble des centres de santé. Nous avons également, nous prévoyons aussi l'intégration des soins attentifs dans les conseils individuels aux portes d'entrée cités plus haut. Également, nous préparons la révision des curricula de formation pour la formation des travailleurs sociaux. C'est une occasion pour nous de prendre en compte ces nouvelles orientations que nous offre le guide. Il y a également la révision de notre protocole de prise en charge de la malnutrition aiguë qui va prendre en compte les soins attentifs. Et puis, nous avons l'opportunité, à travers ces guides, d'avoir une bonne clarté sur le suivi des interventions, sur les soins attentifs. Et enfin, nous souhaitons donc participer à la génération d'évidence pour renforcer l'offre de services au niveau donc, de l'ensemble des structures de santé. Je voudrais terminer en disant que nous avons également l'opportunité d'avoir des documents qui nous permettent de poursuivre notre offre de services dans la convergence et dans la complémentarité des services que nous offre donc aujourd'hui notre stratégie au niveau communautaire. Voilà donc présenté autant d'opportunités que nous avons et que nous aurons à partir d'orientations que nous avons à partir de ces guides. Je vous remercie.
Thank you very much, Dr. Kwame. We have heard from the two governments, from Kenya and also Ivory Coast, but allow me to transition to Perth. So, Marilyn, we have seen, and some of the people on this call can testify of the good works that are happening in Mozambique. So, Perth has been strengthening the workforce capacity to promote nurturing care for the past 10 years. But now, in what ways does the practice guide help address the gaps and also advance efforts to strengthen the healthcare workforce? So how is the practice guide going to help, to close the gaps and advance, the efforts to strengthen the workforce? Over to you, Melanie.
Thank you so much, Boniface. I think what's great about the practice guide is that it targets two important types of stakeholders within health systems: frontline service providers and managers. What PATH has learned over a decade of integrating nurturing care in health systems is that even if you train, mentor, and supervise service providers to deliver nurturing care interventions, they will not perform the additional tasks unless managers provide an enabling environment in which to do them. Section 2 of the practice guide specifically offers recommendations and practical tools for managers to consider and use as they prepare to make health and nutrition services more nurturing. If you take, for example, the checklist to create inclusive, accessible, and welcoming health facilities presented in box 3 on page 19. Now I'm referring to the guide specifically. This is actually a simple tool that managers can use to ensure that more caregiver and child-friendly services are provided. And many times it doesn't take a lot of added effort or cost to introduce specific interventions or settings within health facilities that make them more nurturing. Another important consideration for managers that the practice guide provides and that reflects the day-to-day reality of health systems, particularly in facility settings, is the high turnover of service providers. Integrating responsive caregiving, early learning, safety and security, and caregiver well-being in child health and nutrition services takes provider behavior change. We're talking about shifting how they've been working, focusing on health and nutrition interventions, and now adding components of nurturing care that perhaps were touched on during pre-service training, but were never really strengthened during service delivery. And training, mentorship, supportive supervision, and appropriate motivational inputs are important, but it takes time to change behaviors. And that is true with service providers too. So it is critical that health systems identify strategies to minimize losses in skilled personnel. And the guide lists some of the key strategies that can be put in place. So I think that's a really important thing for managers to be looking at as they integrate other components of the nurturing care framework in existing health and nutrition services. Now, section 3 looks at what frontline providers supported by their managers can do to integrate responsive caregiving, early learning, safety and security, and caregiver well-being at different maternal child health and nutrition contact points. In organizing it by contact point, the guide provides tailored content, most appropriate for specific service providers, and it provides tools they can use to promote optimal caregiving behaviors at each of those contact points. Each contact point offers a unique opportunity to strengthen these optimal caregiving behaviors. And the more contacts you leverage, the more you reinforce the messages. However, given the complexity of health systems and in countries like Mozambique, the resource constraints they face, one may need to select the contact points most feasible to leverage in one specific context. That's why I think it's such a useful tool. Like Annie said, you don't have to do it all at once, but you can select which ones you want to start from. After a decade of learning how to integrate nurturing care in health systems, what I can say is that this is still a learning process. The small strategies for incremental wins that need to be put in place and that offer the best return for investment in specific contexts required continued evidence generation. As practitioners, managers, and different actors in development and humanitarian contexts plan how to integrate nurturing care in health and nutrition contexts, using this guide as a starting point, I'd encourage them to systematically document what works and what doesn't, and how much it actually costs to integrate nurturing care in health systems in different contexts. While we celebrate the launch of this guide that summarizes so much of what we have learned to date, I have no doubt that it will benefit from all the evidence to be generated by those present in this webinar in any future iterations. Thank you so much.
Thank you very much, Meran, for the insights. Allow me to move on and to go to Dr. Rajesh. Dr. Rajesh, how might the handbook be used as a tool to facilitate reflection, also planning and action to advance nurturing care at national and subnational level? So from your experience working at national and subnational level, how is the handbook going to look like in practice? Over to you.
Thank you, Boniface. And thanks for colleagues who have already introduced the guide itself, the handbook and the practice guide. And thanks to Sheila who gave the overview of the handbook. So allow me to actually share with you a story from our Southeast Asia region of WHO where we have actually used this handbook effectively already. So that will illustrate the practical application of this particular tool, which is part of the Nurturing Care framework and Nurturing Care repository of tools. So we have a history of ECD, early childhood development, among our member states. 2010-29, we had a first regional meeting on early childhood development in the Southeast Asia region. And we took stock of what countries are doing, and we found that there was a lot of emphasis on early child education, but that was largely focused on later years of life, that is starting 3 years or maybe sometime a little later. And in terms of health and nutrition, just the traditional health and nutrition services were being provided, not much attention to the responsive care or early learning opportunities. So that was 2010 that the regional office came out with a strategy for ECD to define the role of health sector. But exciting thing happened in 2018 when this Nurturing Care framework was launched, and it brought several concepts together, and one could visualize that how will it look like to provide a package of interventions that can help children thrive beyond survival. Although I strongly believe that the interventions of Nurturing Care also improve survival. But in any case, survive, thrive, and transform. So this was an exciting breakthrough that the Nurturing Care framework could define several concepts and bring them together. So 2019, we thought in the regions, let's do an assessment again, how countries are implementing the 5 components of Nurturing Care, if at all, or else how much is the preparedness at national level across different sectors to implement at scale the 5 components of Nurturing Care. And we found grossly that the countries are doing a lot of stuff, but in a very fragmented manner. So several sectoral interventions and services were there, but it was very difficult to see whether all these services are reaching one family who needs it, one child who needs all these services, because some of the services were delivered for some children, some services were delivered for other children. So we found there is a lot of fragmentation, but in any case, health and nutrition services were kind of the leading services for the age group conception to 3 years, which is the focus of Nurturing Care. But when this handbook was being drafted, it gave us that lead that can we analyze the findings of this assessment using these 5 strategic actions described in the Nurturing Care handbook. And that was clearly found an excellent tool that we could clearly demarcate that there are gaps in the lead and investment component, the strategic action area 1. There were poor intersectoral coordination, although the mechanisms were intended, but very difficult to realize in practice. So policy coherence was a problem. There were multiple policies and with overlapping mandates, and the budgets were inadequate. This is all reported by countries through document review and through key people interviews. And when we analyzed the strategic area 2, the families and communities engagement, we found the community platforms are ready. People are using all countries are using community health workers to deliver services. But very poor engagement in terms of Nurturing Care with the parents and families, with NGOs and CSOs, the civil service organizations, and private sector particularly. The services part, as I mentioned, health and nutrition services are the forerunners, and they were the strongest services. But the component of responsive care, safety, security, and early learning was very limited in most of these countries. There are a couple of bright examples from the region which already had embedded some of this, but in practice, the scale and quality was not reported as great. Monitoring evaluation, again, some indicators related to responsive care, safety and security, early learning, which are also included in the countdown country profiles. So many countries you will see from this region have no data on the indicators related to these 3 components of Nurturing Care. and very little research, local, research and evidence. So it was, we found that this handbook is pretty good to do a situation analysis of a country towards the planning and implementation of nurturing care programs. So we had a regional meeting based on this assessment in April 2021. So that's about 12 years later, after 2009 meeting. And this time, then we oriented them to strategic actions. The member states were there, and we had invited health and education and other sectors all together, and many countries nominated delegations to come and learn. So we worked with them. We demonstrated. Annie Jen were there from UNICEF, Sheila and Bernadette from WHO headquarters, other partners. Shekufe was there. So we had exposed our stakeholders, the member state organizations, the academia, the professional associations, and looking at that, the member states were very clearly able to recommend based on each strategic action area that what could be the way forward, what could be clear actions. So we have a list of those recommendations, like they would want to review and strengthen the laws and policies. They would want to do a leadership strengthening and governance mechanism with adequate financing, and also, set up some intersectoral committees, especially at local level. So there is a clear emphasis on subnational level that we should have those mechanisms, not just at the top, but subnational and local administrative levels, like municipalities and the local village headman or the committee at the village level, to that great detail. And of course, for families and communities, they realized that we should do more. In fact, they decided that the countries should actually prepare a communication strategy for ECD to improve the community awareness and participation in the programs for nurturing care, largely focusing at the demand for services and also strengthening the home care practices. So a lot of communication activities have been identified. So my sense is that this is all because of the better understanding using this tool that countries were able to decide for existing services to make them more nurturing under strategic action 3. So clearly they have said we will pay more attention to responsive caregiving, early learning, security and safety, and very importantly, perinatal mental health. So the care for caregivers, which has been a missing point, was clearly identified because we used the strategic action 3, the guidelines which are there in the handbook. And countries also decided to do the progressive service model by adopting universal services, targeted services, and indicated services for children and families affected by issues related to delayed or deviated development. And importantly, paying attention to quality of services across different sectors, the countries actually made a recommendation for WHO to support countries to set up national standards for services. So that's clear that while health services, quality of care is receiving a lot of attention, can we also prepare something for nutrition, education, and other social support services so that there is a good quality of services in addition to the coverage and equity getting, scaled up. So also capacity building, we heard from other countries that in-service and pre-service education. So that's another great recommendation. So monitoring evaluation, the countries have agreed to administer ECD index with support of partners and also start collecting the missing data, which I mentioned. At the moment, there are weak areas of monitoring. So they would prefer to integrate in national information systems, especially at subnational level. The data originates from there, and there should be analysis at that level also and take actions to improvement. So similarly, they have said that we will like to invest in research and documentation, and especially using digital platforms as solutions, because the COVID pandemic did bring up this possibility that digital platforms can be used for capacity building as well as service delivery. So my message, the endline message of this story is that this Nurturing Care Handbook actually can be used to set up a baseline assessment across sectors. for the 5 components of nurturing care. So I would recommend that countries should actually do the first step as a baseline assessment. And there are tools available to do that. The one which we used in the regional office, but there are others also. And then I would recommend, after this baseline assessment report in hand, the countries should call for a multi-stakeholder consultation and develop working recommendations across the 5 strategic action area, because the concept has gone deep now that we have to link actions in all the 5 strategic areas at once, because all 5 areas are important for a program purpose. And in the end, they would end up doing a national strategic plan and also prepare a sub-national implementation plan in the next phase with learning cycles and scaling up a cyclical approach to scale up. So there is a strong use of handbook in all this planning process, implementation and monitoring the implementation so that the implementation is effective. So I stop here for any further questions or clarifications. Over to you, Boniface.
Thank you very much, Dr. Rajesh. And colleagues, we are going to move on to have a session of question and answers, but I just want to highlight a few things that came out of this conversation. All the speakers touched that we need a strong policy environment. So policies to anchor all these products, and also enhancing coordination, the strong workforce, and ensuring that we are also covering all the 5 components of the nurturing care framework, including also caregiver mental health and well-being. With that, allow me to pass the mic to Chekufe for the next session. Over to you.
Thank you so much, Boniface. I'm wondering if all the panelists and the speakers can turn on their videos. That would be wonderful. So colleagues, as I'm waiting for panelists to turn on their videos, we've had a lot of questions come in the chat. And so we'll begin with some of those. And as we begin with that, I will, you can continue asking questions and also raise your hand. It would be also wonderful to hear from you live. And when you do speak, it would be good if you just kept your questions brief, introduce yourself and where you're calling in from. So just to begin really briefly, just to kick us off, maybe we can just start with a clarifying question that we got from Tomomi Kitamura about the difference between, or how to use the handbook and the practice guide. And maybe I'll turn it to Sheila and Anne to answer this question. He said that they believe the practice guide is more to guide and navigate us on the practical actions to strengthen services and actions while the handbook works more as a reference document. Is that a fair description, or would you provide a little bit more detail about when to use each? So Anne and then Sheila.
Okay, so I speak about the practice guide, which is to divide our roles. You're right, Tomomi. The practice guide focuses on one of the strategic actions, which is strengthening services, and it is particularly targeting the managers and providers and those partners that support the implementation of these services. So it is meant to be very practical, with ideas of things that can be done right away and ideas that might some more strategic thinking, for example, aspects around pre-service training, etc. Sheila, over to you.
Thanks, Anne. And so while the practice guide is very much aligned with Strengthen Services, Strategic Action 3, and it's very much a tool to be used in services, the handbook is more at a higher level. You could think of it as a reference document, but I think, Rajesh, the way you described it as it can help you assess needs in a country, it can help you determine or undertake a situation analysis and plan, defining what we need to do next. Because if we think about ensuring nurturing care, remember when I was presenting, I talked about 2 figures, and the second figure were those green concentric circles, the enabling conditions for children to receive nurturing care. So the handbook, the 5 strategic actions in that handbook, are then looking at what do we need to do in each of those areas to help us put together a composite picture of what can be in place to support children. So it may be that in a particular context, things are moving when it comes to lead and invest, and so policies are in place and maybe the services are getting better, but maybe we don't have the data that we need. or we're not using that data. So then you might focus in on strategic action 4 and look more closely at monitor progress and think about what are actions that you need to take to strengthen that area of work. So it would be predominantly not used at the service delivery level, but more for the level of those that are involved in planning and designing, policy development, interventions, more at that level. But the bottom line is, if we're not working systematically across all 5 strategic actions, we fall short, right? So if we want to see children surviving and thriving, we need to be looking at the 5 strategic actions. And then within that, looking at how do we strengthen the services better using tools like the practice guide.
Wonderful. Thanks, Sheila. All right. So I'm gonna be, looking at the chat, looking at the questions we already have. So bear with me. I wanted to turn it over to Dr. Kwame. If you can answer this question, we have a question from Mark Aguirre, and he's asking: is there a plan? Are there tools? Especially given that you sit with the National Nutrition Program, in your context, are there tools that target parents, families, and communities with community nutrition services as the gateway, specifically looking at community nutrition services? Dr. Kwame, are you able to respond?
Oui. Oui, effectivement, nous disposons de plusieurs outils ou supports pour le renforcement des capacités des prestataires, aussi bien au niveau des structures de santé, mais également au niveau communautaire. Nous développons aujourd'hui une stratégie de convergence à travers donc, les foyers de renforcement de la nutrition au niveau communautaire qui développe des soins de nutrition, des actions essentielles de nutrition pour les mères et les enfants. Et à cela, nous avons intégré le paquet de soins attentifs, donc qui porte sur la stimulation, qui porte sur un ensemble d'offres de services donc au niveau communautaire à travers l'éveil. Et cela prend en compte donc l'accompagnement des parents sur donc l'éveil et les soins attentifs. Donc, nous avons des boîtes à images, vous avez également des documents de référents de formation, des documents de formation des prestataires, des documents, des guides. Et donc, nous avons une très bonne structuration de l'offre. Aujourd'hui, je crois que l'opportunité que nous avons d'avoir ces guides nous permet de revisiter la structuration de l'offre de soins attentifs. Et c'est tout l'intérêt pour nous. Donc, je crois qu'au niveau stratégique, déjà, le fait d'avoir adopté donc les soins dans les services, aujourd'hui, nous sommes en train de descendre pour que, au niveau donc, de toutes les portes d'entrée, on puisse disséminer l'ensemble du paquet. Et on va regarder au niveau clinique, on va regarder au niveau communautaire. Et donc, pour nous, c'est une petite évaluation qui va nous permettre de revisiter, éventuellement de réviser les outils et les documents que nous avons. Voilà ce que je peux dire sur la question. Merci.
Thank you so much. Okay, the next question, Melanie, if you can respond, we have a workforce question. I think I've lost my place in it. Sorry, this new format is quite complicated.
No worries.
All right, here we go. So from a workforce capacity building perspective, we're actually getting a lot of questions. So do you have any reflections about integration of healthcare and early learning systems in for example, the education sector workforce at all, in terms of capacity building for birth to 3 in support for caregivers?
Well, there are a few packages that PAD has provided support in adapting for different sectors, building from, for example, integrated nutrition and early childhood development services that are provided, for example, in community health community settings through health services, and also adapted, for example, for the social action sector. For the education sector in particular, we've been working through multi-sectoral coordination mechanisms to assist different sectors in identifying the different interventions they can do through their sectors to support optimal caregiving behaviors. And so through those interactions, a few activities that come to mind, for example, include training child care providers in like preschool settings, for example, to provide parental education, for example, if there are specific parent groups coming together to discuss their children performance, and also taking that as an opportunity also provide parental guidance. Also training the animators or preschool educators to provide services for children with special needs, so that they understand the different stages of development, the different needs, and can kind of tailor the activities, the play activities, to the different needs of children. I hope that helps answer
Thanks,
the
Melanie.
question.
No, really helpful. And Dr. Rajesh, can we turn to you now? We have a really good question. This has come up several times in the chat, and then I'm going to turn over to some of the folks that have their hands raised. How easily can this, these pathways, these guides be adapted for other sectors? The question is, how easily can it be taken up or adapted and used by other sectors, or do you recommend a health systems approach for early childhood, and is that what the focus is? So I think the main question is, what is the future looking like in terms of addressing other sectors, or is it limited to the health sector at this time?
So, there is a clear admission right up front when Nurturing Care Framework itself was laid down that it is a multi-sectoral action. So clearly, when we define what can happen at what age of that age band, which we are trying to focus, it could so happen that a particular sector is able to take the lead. And other sectors then follow, or not just follow, but contribute in a complementary manner. But countries can actually use different approaches. They could do a multi-sectoral action with a lot of intersectoral coordination, keeping one sector in lead and others to follow. But we have traditionally found that from conception to 3 years, the most common services which come in contact of families of these children are the health services. And the nutrition services, which in many countries are integrated, embedded with health, or are delivered together in many instances. While the other, are providing some bit of referral support through social and welfare systems of that sector, or, or at 3 years of age, when the children are ready for pre-formal education, so to preschool and play and all that, then migration of the lead happens. But countries can adopt any of these. But the beauty of this strategic actions, 5 actions, actually continues to define that these actions are important and can be taken, should be taken across all relevant sectors. So it's not that the actions are relevant only to health. The actions are relevant to all sectors. But when you do the service delivery, first 3 years traditionally would fall there. But without losing the sight that a lot of sectors will come in if there is a child and family who needs more in that age group also. So, but countries that are at liberty to make it work anyway. Over.
Thank you, Dr. Rajesh. And I have one question for Carolyn that's come up in the chat. If you can share from your point of view, from a workforce development, from the Ministry of Health point of view, how do you get providers or different aspects in the different parts of the service? Stanley asked, how do you get them to offer the 5 components that have been covered here?
Sorry, as part of the question?
Yeah, the question is what's the strategy to get different providers within the healthcare system to offer the 5 components that have been covered here, the nurturing care components, and to provide that? Like, what's your perspective from the Ministry of Health? The question specifically is in terms of training. How do you get providers to offer the 5 components?
Okay, so the first strategy would be, because the training all healthcare providers is quite resource intensive, possibly engaging in continuous sensitization of through various platforms. Like we have our associations, various professional associations having continuous medical education, seminars, through hospital, similar CMEs. Just sensitizing them would be a great first step. And then where resources allow, actually taking them through the care for child development training. But a sensitization on the importance, once you're sensitized on why is it important to ensure that all these components are there, and what is the effect of providing. Also, as I said, ensuring that workforce density. Sometimes healthcare providers are so busy, they're overwhelmed with patients, and the amount of time it would take for them to, say, observe caregiving practices, observe child caregiver interactions, and console on the 5 components of nurturing care. So as managers, maybe providing environments that would enable the healthcare providers to have more time, recruiting more healthcare workers, and that goes to resource allocation. So that's one of the ways. But small wins would be just having sensitizations, webinars such as this, and forums where you interact with healthcare providers so that they understand the importance of integrating the components of nurturing care into service delivery. Thank you.
I love that. That's so practical and so pragmatic and feasible. I see Dr. Bokar from Senegal. Do you have a question? Do you want to unmute yourself briefly? Just let us know, what you do, and if you can ask a brief question.
Yeah, thank you so much. I will be very short. From Senegal, I have a technical support of nurturing care. So the Senegal Ministry of Health hired 2 persons to support the Minister of Health with the support of UNICEF to support the Minister of Health to implement nurturing care. So I will be very brief. What we did is Senegal does not have much experience that the people that have presented. We've just started the nurturing care in 2019, and due to COVID-19, people were not able to implement much activities. So this year we did a situational analysis, and we show that one of the main challenges you have is about integration, how to integrate 5 components, since we know that providers are already overwhelmed. In the health sector, they are overwhelmed. In the educational sector, they are overwhelmed. So how to get them to offer 5 components? So what we did is we tried together first. And also we know that in every sector, nutrition, there are some people, some institutions that offer nutrition activities, or the health activities, or the education activities. So each component has some institutions that offer it. So what we did is we tried to gather them. We did some workshops. We drew an operational guide. So that was the first step we did. We drew an operational guide. And in this guide, we had something we call operational sheets. So when you go to consultation, the provider should have one sheet in which you can find all the components and how to offer them together. So that was one of the main things I think I wanted to share.
Interesting.
And we can, that's why we continue to share with the Senegal experience. So integration is a really, really great challenge, and that's why we try to overcome it. But it's not already done, it's something very new, and we are trying to implement, and maybe next time we will come and give the solutions and what we have what we have taken from. Thank you so much.
Thank you so much. And I know we're right at time where we need to move on, but the richness of questions in the chat is enormous. And I'm wondering, Sheila, it might be worthwhile for us to organize just a Q&A session, a technical chat with colleagues on that. So we'll capture all the questions, and we'll definitely keep them in mind. And thank you so much, Dr. Bokar, for sharing the Senegal, experience. And it's clear that we're all grappling with this complex system that we're trying to do, but at the same time, I think the lesson here is that, you know, together incrementally we can make progress. And Dr. Rajesh, I'm going to give you the last word before I hand over to Sheila to share experiences.
Thank you, Shaikufe. Not the last word, but my observation on this comment of the last speaker, that our workers are overwhelmed. You know, that's a very default response at many places and may not reflect the current reality in many situations. We have seen them struggling with regular work, but we have also seen that if you give them something which they find very pleased to do and enjoy, even the hard-pressed village-level workers, health and nutrition extension workers, start enjoying this nurturing care work in their daily routines. It does demand a little bit more time probably, but also on this other side, the infections are going down in many countries in my region. Diarrhea is going down. There is little bit of pneumonia, of course, is there, but people are now in a position to actually offer a little bit more, and the society is also demanding a little more. So I think we should motivate our people, and they will be able to accommodate and enjoy the job. Thank you.
Thank you for that. And with that, Sheila, over to you to share with us even more guidelines and resources that we have and we can all be using. So over to you, Sheila.
Thanks, Rajesh and Shaikufe. Thank you. Rajesh, I just wanted to pick up on your last point there, just to say, as you said, you know, it's not a one-size-fits-all approach everywhere. And I think, Melanie, you alluded to that in the chat, as did Lana, that, you know, we need to look at where are the entry points in each of our contexts. Part of it is where is the need? Where are the most vulnerable children in our context? What services are they accessing and how can we support them better? And then second is, where are those easier entry points? Where's the low-hanging fruit, to use the phrase that Anna used earlier? What can we do? It's not to say that we need to do everything right away. We start where we think there might be success. And Melanie, when you in the chat, you wrote, we want to make sure that we don't treat it as something new or as something different or as something on the side, but rather something that is integral to the way that we support families in our services. And when we frame it that way, and when we look for opportunities to integrate into what we are already doing, we can troubleshoot those issues that often come up around time or other barriers. So before we get to the closing, I'm just going to highlight a few things that are available and coming up for you to know about. One is just to recap the various resources. Today, we focused on two new resources, the Nurturing Care Handbook and the Nurturing Care Practice Guide, which, as you have all observed, have been developed with the health sector in mind, but not exclusively. They can and should be adapted and used by other sectors. So look for ways, look for what resonates for you, and look for how to apply them. There was an earlier resource that was developed right after the framework, which was called Operationalizing Nurturing Care for ECD, health sector alongside other sectors. So right from the beginning, with this idea and this understanding, as Rajesh said, for us to achieve what we want to achieve, we need to think multi-sectorally. There was a question in the comments about, do we have to have coordination? Ultimately, we do need to work together. We need to find a way to work together. Can we do things alone? Yes, there are some things that each sector and each constituency group can do alone, but we will do more if we can work together. So these resources are a point of reference for you. On the right-hand side of the screen are various thematic briefs that look at how we can think about nurturing care for different populations or different issues. So for example, men's engagement in nurturing care or nurturing care for children affected by HIV. These go into more practical solutions around policy and services, things that you can be thinking about. And then we just wanted to bring to your attention a few new resources that are in progress at the moment. This May will mark the 5-year milestone for the Nurturing Care Framework. And so we are developing with UNICEF and WHO together a progress report taking stock of what has happened around the world across the 5 strategic actions. What have we learned and what's the way forward? This will be launched, in May. So stay tuned for more information on that. And then as a continuation on the series of thematic briefs, there are 2 more that are in development, one around responsive feeding and the other around children with developmental delays and disabilities. So all of these will continue to be shared, especially if you're on the ECDAN mailing list, you will get notified as and when things are made available. Next slide. So those were all resources that come under the quote unquote nurturing care umbrella. But if we think more broadly, there are so many things that are available that are in our toolkit that we should be turning to. So here are a few new things that have come or are coming in the recent months. So strengthening implementation of home-based records for MNCH, guidelines on parenting interventions to prevent maltreatment and enhance parent-child relationships, the global scales for early development, looking at measurement at population levels for children birth to 3 years of age. And then very soon, we will also have the Caring for the Caregiver package to support more attention to how we look after caregivers in our context. So we will provide the links in the email that goes out afterwards, so you have access to these resources as well. Next slide. And the last is just to let you know about 2 events that are coming up this month. Next Thursday, the 6th of April, there will be another webinar focusing in on the practice guide. It is being hosted by the Health Systems for ECD Initiative for Europe and Central Asia. So it will have more of a focus on how the practice guide could be utilized by different stakeholders in that region. And then on the 20th of April, the strengthening implementation of home-based records for MNCH, the practical guide will have its official launch on the 20th of April, and we'll include the links to register for these in the email with the recording afterwards. So next slide. I think with that, we are getting ready for the closing, and I'd like to hand over to Anshu Banerjee, who's the Acting Interim Assistant Director General for the Division of Universal Health Coverage and Life Course, and also the Director for the Department of Maternal, Newborn, Child and Adolescent Health and Aging. Over to you, Anshu.
Thanks a lot, Sheila. And I would like to thank everyone for joining today. And in particular, I would like to thank the presenters and panelists for their contributions. It's been a very rich and informative webinar, and we could see from all the questions that were put forward, let's say, that this really struck the right chord, let's say, with the audience. I think we all agree that early childhood development is everyone's business. Children are enabled to unlock their potential when they are supported from before birth by enabling environments that provide love, protection, nourishment, health, responsive caregiver-child interactions, and learning activities. It is important from a human capital development perspective, as well as from a human rights perspective, that every child should have the same opportunity to grow and develop. Within the global community concerned with maternal, newborn, child, and adolescent health, we have ample opportunities to contribute to this agenda. Every contact that a caregiver and a young child has with a healthcare provider is an opportunity to support early childhood and development. To summarize what we discussed, the practice guide helps planners and implementers to strengthen health and nutrition services. The handbook looks at the 5 strategic actions and provides guidance for activities that include but are not limited to the health sector. As we are crossing the midway point towards the attainment of the Sustainable Development Goals, and I must say we are at the midway point in a number of years, but definitely not in achieving the goals, we all have an interest in joining hands and stepping up the effort. Recent results from population surveys conducted in Africa remind us that at least 1 in 5 children are not achieving their potential development. The evidence that underpins the nurturing care framework has shown us that it is feasible and affordable to change this stark reality and improve children's developmental outcomes. We can do so by working together so that every newborn can make the best start in life. Women, children, and adolescents receive quality healthcare services, and parents and other caregivers are supported in their capacity to provide nurturing care. I'd like to thank the ECD Action Network, the Quality of Care Network, and the Child Health Task Force for partnering with WHO and UNICEF in preparing this webinar and for reaching out to a wide community of stakeholders. When all of us are speaking with one voice and working together, we can make a difference. On behalf of UNICEF and WHO, I would like to thank all who attended this webinar once again for your interest. And the Nurturing Care Progress Report from 2018 to 2023 that will be released on 24 May this year will provide further documentation of progress. We count on you and your commitment to use the new and available tools to make change happen. Thank you all once again, and goodbye.
Thank you.